Mpox. It's a word that has been making headlines recently, raising concerns and questions worldwide. This disease, once confined to specific regions, has now emerged as a global health concern. While not entirely new, its recent spread has brought it to the forefront of public attention. Understanding Mpox is crucial for everyone, as knowledge is the first step in prevention and protection. The recent outbreaks have highlighted the speed at which infectious diseases can spread in our interconnected world. No longer a distant threat, Mpox has become a reminder of the importance of public health awareness and preparedness. In this exploration of Mpox, we will delve into the essential information you need to know. We will cover everything from its origins and symptoms to transmission methods, diagnosis, and treatment options. By the end of this essay, you will have a comprehensive understanding of Mpox, empowering you to make informed decisions regarding your health and well-being. Mpox, also known as monkeypox, is a viral disease that poses a significant threat to global health. Its recent spread beyond its traditional endemic areas has sparked concern. Mpox belongs to the pox virus family, a group of viruses known for causing disease in humans and animals. The virus was first discovered in 1958 in monkeys. However, rodents are now considered the primary reservoir of the virus. Recently, there has been a surge in Mpox cases in non-endemic countries. This unprecedented spread has raised alarm bells among health officials and the public alike. Navigating the complexities of a disease outbreak can be overwhelming, especially with the constant influx of information. This essay serves as your comprehensive guide to understanding Mpox, providing you with accurate and up-to-date information to empower you to make informed decisions about your health. We will break down the science behind Mpox in a clear and accessible way, ensuring that you grasp the key concepts without feeling overwhelmed. Our journey will begin by exploring the typical symptoms of Mpox, from the initial flu-like signs to the characteristic rash and its progression. Understanding the timeline and appearance of these symptoms is crucial for early detection and seeking prompt medical attention. Next, we will delve into the various ways Mpox can spread, emphasizing the importance of preventive measures to protect yourself and your loved ones. We will discuss direct and indirect transmission routes, highlighting the role of close contact, bodily fluids, and contaminated objects. Armed with this knowledge, you will be better equipped to minimize your risk of infection. Mpox, a term that has recently entered our collective vocabulary, represents a viral disease that demands our attention. To fully grasp the implications of Mpox, we must first understand its fundamental nature. Mpox is not a new disease. It has been known to the scientific community for decades. However, its recent surge in cases globally has thrust it into the spotlight, raising concerns and prompting a renewed focus on its characteristics and transmission patterns. Mpox belongs to the orthopox virus genus, a group of viruses known to infect both humans and animals. Within this genus, Mpox is classified as a zoonotic disease, meaning it can be transmitted from animals to humans. The virus primarily resides in certain animal populations, with rodents currently considered the main reservoir. However, humans can contract the virus through contact with infected animals or through human-to-human transmission. The virus, upon entering the human body, hijacks the cellular machinery to replicate and spread, leading to a range of symptoms and health complications. Understanding the virus's life cycle and its interaction with the human immune system is crucial for developing effective prevention and treatment strategies. Section 2. Unmasking the virus. The Mpox virus, like all viruses, is a microscopic entity incapable of independent survival. It relies on invading host cells to replicate and spread. The virus's structure, composed of genetic material encased in a protein shell, dictates its mode of infection and its ability to evade the host's immune system. Upon entering the body, the virus targets specific cells, typically those of the skin, mucous membranes, or respiratory tract. It attaches to the surface of these cells and injects its genetic material, effectively hijacking the cell's machinery to produce more virus particles. As the virus replicates, it triggers an immune response in the host, leading to the characteristic symptoms of Mpox. The immune system, recognizing the virus as a foreign invader, mounts an attack to neutralize and eliminate it. This immune response, while essential for fighting off the infection, can also contribute to the development of some symptoms. The severity of the disease depends on various factors, including the individual's immune status, age, and overall health, as well as the specific strain of the virus. Section 3. Not just a distant relative. The Mpox virus shares its lineage with other members of the Poxviridae family, a group of large, complex DNA viruses. Most notably, Mpox is closely related to the variola virus, the causative agent of smallpox. This close relationship has significant implications for both the understanding and management of Mpox. The genetic similarities between Mpox and smallpox have led to cross-protective immunity. This means that individuals vaccinated against smallpox have a degree of protection against Mpox infection. The smallpox vaccine, widely credited with the eradication of smallpox, has been shown to be about 85% effective in preventing Mpox. This cross-protection highlights the potential for utilizing existing smallpox vaccines or developing new targeted vaccines to combat Mpox. However, despite their shared ancestry, Mpox and smallpox are distinct diseases with different clinical presentations and epidemiological characteristics. While smallpox was a highly contagious and deadly disease, Mpox generally causes milder symptoms and has a lower mortality rate. Understanding the nuances of these differences is crucial for developing effective public health strategies tailored to the specific challenges posed by Mpox. Section 4. The global landscape of Mpox. Traditionally, Mpox was primarily confined to certain regions of Africa, with sporadic outbreaks occurring in Central and West African countries. However, in recent years, the epidemiological landscape of Mpox has shifted dramatically, with the virus spreading to non-endemic countries across the globe. This unprecedented global spread has raised concerns about the changing dynamics of the virus and the potential for sustained transmission in new populations. Several factors contribute to this global emergence, including increased international travel and trade, urbanization, and encroachment into wildlife habitats. As people travel more frequently and over longer distances, the opportunities for infectious diseases to cross borders increase. Furthermore, changes in human behavior, such as closer contact with wild animals and the pet trade, may play a role in facilitating the spillover of the virus from animals to humans. The global interconnectedness of modern society underscores the importance of international collaboration and coordinated public health efforts to effectively monitor, control, and prevent the further spread of Mpox. In the face of the evolving threat posed by Mpox, staying informed and adopting preventive measures are paramount. Knowledge is our most potent weapon against infectious diseases. Understanding how Mpox spreads, recognizing its symptoms, and taking steps to minimize personal risk are crucial for protecting ourselves and our communities. Public health education campaigns play a vital role in raising awareness about Mpox, dispelling myths, and providing accurate information. Individuals should be aware of the potential risks associated with contact with wild animals, particularly rodents, and practice safe hygiene practices such as frequent hand washing and avoiding contact with sick individuals. Healthcare professionals are on the front lines of the fight against Mpox, and their role in early detection, diagnosis, and management of cases is crucial. Timely reporting of suspected cases, prompt isolation of infected individuals, and contact tracing are essential for containing outbreaks and preventing further spread. The global community must work together to strengthen surveillance systems, enhance laboratory capacity, and ensure equitable access to vaccines and treatments. By taking proactive steps and fostering international collaboration, we can mitigate the impact of Mpox and safeguard global health. The onset of Mpox typically begins with early symptoms that can easily be mistaken for other common illnesses, particularly influenza. These initial signs are often non-specific and include high fever, severe headache, muscle aches, and profound fatigue. These symptoms usually emerge within 1 to 2 weeks following exposure to the virus. The high fever is usually the first symptom to appear, often exceeding 38.5 degrees Celsius, 101.3 degrees Fahrenheit. This is typically accompanied by intense headaches and muscle pain, which can be debilitating. Fatigue sets in rapidly, leaving the individual feeling extremely weak and unable to perform daily activities. Another critical early symptom is lymphadenopathy, or swollen lymph nodes, which is a distinguishing feature of Mpox compared to other similar illnesses. The lymph nodes, particularly those in the neck, armpits and groin, become visibly swollen and tender to the touch. This symptom often appears before the characteristic rash, serving as an early indicator of Mpox infection. Recognizing these early symptoms is crucial for prompt medical evaluation and diagnosis. Early detection can lead to timely isolation and treatment, reducing the risk of spreading the virus to others. As the disease progresses, Mpox symptoms become more severe and distinctive. Initial flu-like symptoms are followed by a rash, marking specific stages of the illness. The rash starts as small, flat, red spots, often beginning on the face. These spots spread to the hands, feet, and trunk. Over time, they evolve into raised bumps, which can be intensely itchy. These bumps then transform into fluid-filled blisters. Blisters can be very painful, especially in sensitive areas like the mouth and eyes. Monitoring these symptoms is essential for determining the appropriate treatment. Section 3. Rash development, identifying the hallmark. The Mpox rash is a definitive sign for diagnosis. It starts on the face and spreads to the body within 24 to 48 hours. Papules evolve into vesicles and pustules filled with pus. These pustules are surrounded by a red halo and can become quite large. The rash is typically centrifugal, concentrating on the face, arms and legs. This pattern helps differentiate Mpox from other diseases. Section 4. Blister formation, the next stage. Following the development of vesicles, the next stage in the progression of Mpox is the formation of blisters filled with clear fluid. These vesicles eventually become pustules filled with pus, which are highly characteristic of the disease. This stage is not only a critical point in the disease's progression, but also a time when the patient is most contagious. The pustules can be painful, especially when they merge to form larger lesions. They are often surrounded by a red, inflamed area, indicating the body's ongoing immune response. As the pustules mature, they become more prominent and can cause considerable discomfort. During this stage, patients may also experience symptoms such as swollen lymph nodes, fever, and general malaise. The presence of these pustules, along with systemic symptoms, can severely impact the patient's overall well-being, necessitating supportive care and pain management. The formation of these pustules is a crucial period for preventing the spread of the virus. Patients should adhere to strict isolation protocols, and caregivers should use appropriate protective measures to avoid direct contact with the lesions and bodily fluids, which are highly infectious. Section 5. Scabbing and healing. The final phase. The final phase of Mpox involves the scabbing over of the pustules and the beginning of the healing process. Once the pustules mature, they rupture and dry out, forming scabs. This phase occurs 7 to 14 days after the rash appears. The scabs can be thick and crusty, taking weeks to fall off. New skin layers develop underneath the scabs. This process can be itchy but indicates healing. While many individuals recover from Mpox without significant issues, some may experience complications that can have long-term health impacts. Secondary bacterial infections of the skin are a common complication, often resulting from scratching the lesions. Severe Mpox can lead to pneumonia, particularly if the virus spreads to the respiratory system. Other potential complications include encephalitis, which is inflammation of the brain causing neurological symptoms and long-term cognitive impairments. Scarring is another significant long-term effect of Mpox, especially if lesions are deep or secondarily infected. Psychological impacts, including anxiety and depression, can also result from the physical and social consequences of the disease. Mpox spreads through specific transmission routes, crucial for implementing effective prevention and control measures. The virus, primarily found in certain animal populations, can jump to humans through various means, and once in humans, it can spread further through human-to-human transmission. The most common route of Mpox transmission is through direct contact with an infected animal or human. Human-to-human transmission occurs primarily through close contact with an infected person's respiratory secretions, skin lesions, or bodily fluids. It's important to note that Mpox is not as easily transmissible as some other viral diseases, such as measles or COVID-19. Transmission typically requires close, sustained contact with an infected individual or animal. By understanding the various ways Mpox can spread, we can take appropriate precautions to protect ourselves and others from infection. Animal-to-human transmission, also known as zoonotic transmission, is the primary way Mpox spreads from its natural reservoir to humans. The virus is believed to primarily reside in certain rodent species such as rope squirrels, tree squirrels, Gambian pouched rats, and dormice found in parts of Africa. Humans can become infected through various interactions with these animals, including hunting, handling, butchering, or coming into contact with their habitats. Even contact with dead animals can pose a risk, as the virus can survive in the carcasses for some time. Preventing animal-to-human transmission involves raising awareness about the risks associated with handling wild animals and promoting safe practices in hunting and food preparation. Human-to-human transmission, close contact matters. While animal-to-human transmission is the initial step in Mpox outbreaks, human-to-human transmission plays a crucial role in the spread of the disease within communities and across borders. The virus can be spread through direct contact with an infected person's bodily fluids, such as saliva, blood, or pus from skin lesions. Respiratory droplets expelled when an infected person coughs, sneezes, or talks can also carry the virus, usually requiring prolonged face-to-face contact. Contact with contaminated materials, such as bedding, clothing, or towels used by an infected person, can also lead to transmission. Preventing human-to-human transmission involves isolating infected individuals, practicing good hand hygiene, wearing masks in healthcare settings, and avoiding close contact with anyone showing symptoms of Mpox. The role of contaminated objects. While direct contact with infected individuals or animals is the most common mode of Mpox transmission, contaminated objects can also play a role in spreading the virus. This indirect transmission occurs when a person touches an object that has been contaminated with the virus and then touches their eyes, nose, or mouth. Objects that come into frequent contact with an infected person's skin lesions or bodily fluids, such as bedding, clothing, towels, utensils, and toys, pose a higher risk of contamination. In healthcare settings, medical equipment, surfaces, and linens can become contaminated if not properly disinfected. Regular cleaning and disinfection of frequently touched surfaces, proper handling and laundering of contaminated materials, and avoiding sharing personal items with infected individuals can significantly reduce the risk of transmission through contaminated objects. Protecting yourself and others. Protecting ourselves and others from Mpox requires a multifaceted approach that combines individual responsibility with public health measures. One of the most effective ways to prevent Mpox is to avoid contact with infected animals, especially rodents, which are considered the primary reservoir of the virus. Practicing good hygiene is paramount in preventing the spread of Mpox, including washing hands thoroughly with soap and water for at least 20 seconds. Avoiding close contact with infected individuals is crucial for preventing human-to-human transmission. In healthcare settings, healthcare workers should follow strict infection control guidelines, including wearing appropriate personal protective equipment. Vaccination is another important tool in preventing Mpox, with the smallpox vaccine providing some cross-protection against the virus. Diagnosing Mpox begins with a comprehensive assessment of the patient's clinical presentation and medical history. One of the primary indicators of Mpox is the presence of the distinctive rash, which progresses through various stages. The distribution of the rash, often concentrated on the face, arms, and legs, can help differentiate it from other rash-causing illnesses. Healthcare providers will inquire about the patient's recent travel history and potential exposure to infected animals or individuals. The presence of other symptoms, such as fever, headache, muscle aches, swollen lymph nodes, and fatigue, strengthens the suspicion of Mpox. The combination of these clinical findings, along with the patient's history, guides the healthcare provider in determining the need for laboratory testing to confirm the diagnosis. While clinical evaluation provides valuable clues for suspecting Mpox, laboratory testing is essential for confirming the diagnosis. The most commonly used and reliable method for diagnosing Mpox is polymerase chain reaction, or PCR testing. Samples are typically collected from skin lesions, swabs from the back of the throat, or blood. Another laboratory technique, viral culture, involves growing the virus from patient samples in a laboratory setting. Serology tests, which detect antibodies produced by the body in response to Mpox infection, can also be used for diagnosis. The clinical presentation of Mpox can share similarities with other infectious diseases, making it crucial to consider a range of possible diagnoses. One of the key conditions to differentiate from Mpox is chickenpox, another viral illness characterized by a rash. Chickenpox typically presents with a more widespread rash that often starts on the trunk, while Mpox tends to concentrate on the face and extremities. Other infectious diseases that may mimic Mpox include measles, rubella, syphilis, and herpes simplex virus infection. In addition to infectious diseases, allergic reactions, insect bites, and certain skin conditions can also cause rashes that may resemble Mpox. By carefully considering all possible diagnoses and performing appropriate laboratory tests, healthcare providers can accurately identify Mpox and initiate appropriate treatment and infection control measures. Prompt action for effective management. Accurate and timely diagnosis of Mpox is essential for initiating appropriate treatment and preventing further spread of the virus. Isolation of infected individuals is crucial for preventing the spread of Mpox to others. Contact tracing helps identify individuals who may have been exposed to the virus and allows for early intervention. Treatment for Mpox is primarily supportive, as there is no specific antiviral therapy proven to be effective against the virus. Supportive care aims to alleviate symptoms, prevent complications, and promote healing. Vaccination with the smallpox vaccine can be considered for individuals who have been exposed to Mpox. Prompt diagnosis, coupled with effective isolation, contact tracing, and supportive care, forms the cornerstone of Mpox management. Managing the symptoms. While there is no specific cure for Mpox, most cases resolve on their own with proper care. Treatment primarily focuses on alleviating the uncomfortable symptoms and supporting the body's natural healing process. Over-the-counter pain relievers, such as ibuprofen or acetaminophen, can effectively reduce fever and alleviate headaches and muscle aches. The characteristic rash often causes significant discomfort, and managing its symptoms is paramount for the patient's well-being. Cool compresses, calamine lotion, or oatmeal baths can provide relief from itching and irritation. The role of antiviral medications. In some cases, particularly those involving severe illness or individuals with weakened immune systems, antiviral medications may be considered as part of the treatment plan. Cidofovir and tecovirimat are two antiviral drugs that have shown some efficacy against Mpox in laboratory and clinical settings. The decision to use antiviral medications is made on a case-by-case basis, considering factors such as the severity of the illness and the patient's overall health. Close monitoring by a healthcare professional is essential throughout the course of antiviral therapy. It's important to note that antiviral medications are not a substitute for preventive measures such as vaccination and infection control practices. Section 3. Harnessing the power of vaccination. Vaccination plays a crucial role in preventing and controlling Mpox outbreaks. The smallpox vaccine provides cross-protection against Mpox. It contains a live virus called vaccinia, related to smallpox and Mpox. The immune system produces antibodies that protect against both. Studies show the smallpox vaccine is about 85% effective in preventing Mpox. Vaccination is recommended for high-risk individuals. Section 4. Supportive care, a holistic approach. Beyond managing the specific symptoms of Mpox, providing comprehensive supportive care is crucial for the patient's overall well-being and recovery. Supportive care addresses the physical, emotional, and social needs of the individual throughout their illness journey. Adequate rest and hydration are essential for the body to fight off the infection and promote healing. Patients should be encouraged to drink plenty of fluids, such as water, clear broths, or electrolyte solutions, to prevent dehydration, especially if they have a fever. Nutrition plays a vital role in supporting the immune system and promoting recovery. Patients should consume a balanced diet rich in fruits, vegetables, and lean protein to provide their bodies with the nutrients they need to heal. Pain management is another crucial aspect of supportive care, as the rash and other symptoms can cause significant discomfort. Over-the-counter pain relievers, cool compresses, and topical treatments can provide relief. Emotional support is equally important, as the diagnosis of Mpox can be stressful and isolating. Providing patients with clear and accurate information about their illness, addressing their concerns, and offering emotional support can significantly impact their coping mechanisms and overall well-being. Section 5. The road to recovery, patience and persistence. Recovering from Mpox requires patience and persistence. Most people recover within a few weeks, but it varies. Practice good hygiene and avoid close contact until fully healed. Prioritize rest, hydration, and a healthy diet. Gradually return to normal activities as symptoms subside. Seek medical attention if new symptoms occur. With proper care, most make a full recovery. Section 1. Mpox, a global health challenge. Mpox has emerged as a significant global health challenge, demanding our attention and proactive measures. As we've explored in this comprehensive overview, Mpox is a viral disease with roots in certain animal populations that can spread to humans and then further transmit within communities. While generally less severe than its relative, smallpox, Mpox can still cause debilitating symptoms and, in some cases, lead to complications. The recent increase in Mpox cases worldwide underscores the interconnectedness of our world and the ease with which infectious diseases can transcend borders. Factors such as international travel, urbanization, and human-animal interactions have contributed to the virus's spread beyond its traditional endemic areas. Understanding the various transmission routes of Mpox, from animal to human to human to human transmission, is crucial for implementing effective prevention and control measures. Knowledge empowers us to make informed decisions about our health and to take steps to protect ourselves and our communities. Prevention, our strongest defense. Prevention is our most potent weapon against infectious diseases like Mpox. By adopting preventive measures, we protect ourselves and our communities, avoid contact with infected animals, especially rodents. Practicing good hygiene is crucial. Wash hands thoroughly with soap and water. Avoid close contact with infected individuals. Wear a mask if close contact is unavoidable. Section 3. Staying informed, staying safe. Staying informed about Mpox and following the guidance of public health authorities is crucial for staying safe. Public health agencies, such as the World Health Organization (WHO) and the Centers for Disease Control and Prevention (CDRC), provide up-to-date information on Mpox outbreaks, prevention measures, and treatment recommendations. It's important to rely on credible sources of information and to be wary of misinformation that can circulate during outbreaks. Checking official public health websites, consulting with healthcare professionals, and relying on reputable news outlets can help ensure that you are accessing accurate and reliable information. If you experience any symptoms of Mpox, such as fever, rash, or swollen lymph nodes, it's crucial to seek prompt medical attention. Early diagnosis and treatment can help manage symptoms, prevent complications, and reduce the risk of spreading the virus to others. Mpox, like many health challenges, requires a collective effort to control and prevent its spread. By staying informed, adopting preventive measures, and supporting public health initiatives, we can work together to mitigate the impact of this disease and protect the health of our community.